Today we're going to talk about the best food to prevent heart attacks and strokes. There's something very particular about heart attacks and strokes. Between 80% and 90% of heart attacks are caused by blood clots. And you might think this is due to plaque buildup, but it's not. Most heart attacks come from blood clots. In addition, between 87% and 91% of strokes are also caused by clots. The food we're going to talk about today has everything to do with preventing these clots, and this information is based on the research of Professor Douglas Kell, a true genius. I'll include a link with references to part of his work, but he discovered something fascinating about dormant microbes. Many of these dormant microbes are actually pathogens, meaning they can cause disease, but they stay asleep, waiting for an opportunity to reactivate. For example, in winter, there are many microbes in the soil that freeze but enter a dormant or spore-like state, waiting for the season to change so they can awaken and thrive. Here's what you need to know. Normally, when a clot forms, whether from a cut on your finger or something internal, certain proteins form the clot, and then, once the wound heals, it dissolves in minutes, hours, or a bit longer. That's the normal clotting process, and without it, we would bleed to death. However, under certain conditions, especially during a heart attack or stroke, a different type of clotting occurs. Instead of a normal clot, dense, tangled fibers form, like hard spaghetti, which are very difficult to dissolve. In most heart attacks and strokes, we're not dealing with a normal clot, but with an abnormal, dysfunctional one. What causes this dysfunctional clotting? The first cause is a leak, either in the gums or the intestines. If you have a certain type of pathogen that releases part of its outer layer, called an endotoxin, even a tiny amount of that endotoxin is enough to turn a normal clot into an abnormal one. Even when doctors find soft plaques in the arteries, they often find endotoxins inside them, tiny fragments of those pathogens. Excess iron. Your body carefully controls iron levels because too much iron feeds pathogens. While we need oxygen to live, pathogens feed on iron. If there's too much free iron in the body, it can activate dormant microbes and cause more clotting. That's why people with genetic iron overload are at higher risk for heart attacks, strokes, and inflammation. You should be careful with extra iron, especially as you age. Excess iron often comes from fortified foods, like cereals, breads, and pastas with added iron. It can also come from supplements. I would never recommend an iron supplement, not even for someone who's anemic. In that case, it's better to get heme iron, which is easily absorbed from red meat or liver, not from common supplements. I also don't recommend cooking with cast iron pans, since they release iron into the food. And as an extra note, alcohol increases iron levels in the body. The role of stress. When you're stressed, adrenaline levels rise, which enhances pathogen activity by allowing them to consume more iron. Stress weakens the immune system, letting microbes grow out of control. Even steroids, which are synthetic versions of cortisol, another stress hormone, can completely shut down your immune system. That's why, when someone goes through great stress or deep emotional loss, the risk of dying from a heart attack increases by up to 2,000%. Gut and gum leaks. It's also important to understand what causes these leaks in the gums or intestines. In the gut, the most common causes are gluten, a protein that's difficult to digest, alcohol and tobacco, refined seed oils, which oxidize tissues, ultra-processed foods, sugars, and refined flours that feed pathogenic microbes, anti-inflammatory painkillers, NSAIDs, which damage the intestinal lining, antibiotics, which disrupt gut flora, the perfect food to prevent clots. When most people think about preventing heart attacks or strokes, they think about lowering cholesterol or cutting saturated fat, but that's based on outdated and incorrect information. I don't recommend following that idea. 1. The best protein, wild salmon. Wild salmon is the best type of protein because it's low in iron and high in omega-3 fatty acids, which reduce inflammation and thin the blood, helping to prevent clots. Other fatty fish are also good, but wild salmon is ideal. 2. Antithrombotic salad. Pair the salmon with a salad made of arugula, rich in nitric oxide, a molecule that helps dilate blood vessels and prevent clots. Beetroot, also high in nitric oxide. Extra virgin olive oil, Contains polyphenol that reduce free iron and act as anti-inflammatories. Apple cider vinegar helps repair gut leaks. Garlic strengthens the cardiovascular system, dissolves clots, fights pathogens, and neutralizes excess iron. 3. Fermented foods. Add a bit of sauerkraut, about a quarter cup, which contains lactic acid bacteria that neutralize endotoxins. You can also get similar benefits from a little kombucha or fermented pickle juice. 4. Extra polyphenol. Have a cup of green or black tea with your meal, as both help bind excess iron. And for dessert, a bit of dark chocolate, 85% or higher, which provides polyphenol and magnesium, an essential mineral for the heart. Magnesium relaxes arteries, lowers blood pressure, and helps with atrial fibrillation. You can even add pure cocoa powder to your morning coffee to boost polyphenol. 5. The final touch movement. After eating, take a 10 to 20 minute walk while breathing through your nose. Nasal breathing increases nitric oxide, improves oxygenation, and exercise helps dissolve clots and balance blood sugar. By combining this meal and this habit, you can drastically reduce your risk of heart attacks and strokes. Now that you understand more about clots, the next most important thing to learn is the powerful effects of magnesium on the cardiovascular system. In addition to diet, there are everyday factors that directly influence the formation or dissolution of clots, and many people overlook them. Cardiovascular health depends not only on what we eat, but also on how we live, sleep, breathe, and move. One of the biggest enemies of the heart and brain is a sedentary lifestyle. When we sit for hours, blood circulation slows and becomes thicker. This lack of movement promotes microclots that over time can damage the arteries. That's why, besides walking after meals, it's essential to stand up every hour, stretch your legs, and maintain good posture. Another key factor is hydration. Blood is largely made up of water, and when the body is dehydrated, it becomes thicker and more prone to clotting. Drinking enough water, especially mineral water rich in magnesium, helps maintain blood fluidity and improves cellular oxygenation. We also need to talk about sleep, one of the most neglected pillars. Sleeping less than 6 hours a night doubles the risk of a cardiovascular event because the body cannot regulate blood pressure or repair inflamed tissues. During deep sleep, hormones are released that dissolve microscopic clots and reduce arterial inflammation. Blood sugar control is another essential point. Every glucose spike damages the inner lining of blood vessels and creates an environment where fibrin, the main material of clots, accumulates. Maintaining a diet low in refined sugars and rich in vegetables, healthy fats, and lean proteins helps keep blood cleaner and more stable.